I'm so excited to have Dr. Jochen with us this morning. It's always a treat having you in here with us because
thank
you know so much and you educate us so well. And today you're once again surprising me with what we talk about during the breaks, and that is that, you know, most of us think about melanoma. That's the only thing we ever think about when we talk about skin cancer, but there are other forms that are just as deadly.
Yes, exactly. Well, the most common is basal cell, which is very rarely deadly, and the second most common is squamous cell carcinoma. And if you let squamous cell carcinomas are like melanomas, they can break off and metastasize to other areas of your body and can actually kill you.
But now you're here to talk with us about preventing that from ever getting to that point.
Exactly.
And you're part of a study, right?
Yes, exactly. We have this study for actinic keratoses, and what they are is they're precancers. And they're pretty easy to identify in your skin because they're red and scaly. So if you run your fingers across your face, you'll feel them. And they occur most commonly in sun-exposed areas. So we want to treat those before they become a squamous cell carcinoma, which then can lead to a deadly cancer.
So you're saying if you find like a patch of skin that's red and itchy or dry, is that what you're saying?
Red and scaly, not
itchy. Red and
scaly. That
doesn't
go away.
Okay.
Yes.
And it can be on any part of your body or that's exposed to the sun?
Most commonly sun-exposed areas,
okay.
Exactly.
And if you feel it, then you should come in and see you.
Get it evaluated, yes.
And so then what takes place next?
Well, typically we'll freeze them or do something like that, but the exciting thing is we have this study right now that's a plant extract, and you can apply it to your skin and be part of this study that's changing medicine. So for people who are afraid of medical treatments and, I know you are. Exactly.
Stay away from
chemicals. You know, we have a natural product that we can use now. And so this is a study that we're doing. And if you participate in the study, you actually get paid to participate in the study. So it's pretty exciting.
Wow. I don't have any of those on my body, though.
I was looking at you and I'm like, you have perfect skin. So you're unusual out here.
But I'm thinking that's a good deal. If you've got something like this where you'd actually be paid. And you see this is more common in the Caucasian as well.
Yes, because it's caused by sun exposure and sunburn. So if you're darker skin types, typically you have pigment that protects your skin from damage. So lighter skin people are more susceptible. So particularly people who have had sunburns in the past, because that means that your skin is easily damaged by the sun.
Well, let me ask you this, though. Now, you mentioned that as sunburns in the past, but aren't we seeing a trend that even younger people are getting diagnosed with skin cancer earlier than what we thought? You usually think of skin cancer as an old person's disease. That's not the case anymore.
It's not the case. You know, people still use tanning beds, believe it or not, even though they're becoming illegal for younger people, but people still use tanning beds. And people go out in the sun. A lot of people are still getting sunburns.
Well, you can't avoid it living here in the desert. That's
Exactly.
what makes it even more dangerous, is that just being in your car, you're exposed to the sunshine here.
Exactly.
So, okay, so this is called, again, the name of it, and what should people do? They should contact you?
It's a clinical trial, and the ingredient is Solanum undatum, and we are doing the trials until the beginning of next year. So
so you have room for more?
We have room for more, yes.
Okay.
So if you have any precancers, please come in and see us.
Yeah, and the way to check that on your body is to
look for red scaly bumps that aren't disappearing. And we're happy to screen you, so if you think you have them, just come in and we'll do the evaluation for you.
All right, all the information is on your screen, how to contact Dr. Timothy Jochen. Again, thank you so much for coming in this morning.